And there we go. Okay, so I am here with Dr. Robert Eastlack. And why don't you just go ahead and introduce yourself? What sport and when you graduated, and just sort of some general info on where you are now.
Yeah, sure. I'm now getting to be an old guy. Graduated in '94, Stanford men's swimming team from '90 to '94. Interesting, was just a walk on, but had a great run, and the team had 3 national titles while we were there. So it was a tremendous time for men's swimming back then. And I met my lovely wife in the varsity weight room. She's a soccer goalie, so many years ago we met, and then we went to med school together, and then came out to San Diego at UCSD to train. She's in dermatology, and I came out here for orthopedic surgery. It was a nice place, obvious, to live, but our main intention was to get a little closer to our families. At that point, they were both out here, and they both had solid programs at UCSD. So we trained there. And then I went back to Mayo Clinic in Rochester, Minnesota for fellowship in spine, and came back out to San Diego and was at UCSD for a bit, and then came over to Scripps Clinic about 13 years ago now. And that was a nice move. This facility is a little bit like Cleveland Clinic or Mayo Clinic or that sort of model. So it's a very large group of providers, academic. We did probably 2 or 3 times the research that our partners at UCSD do, and teach along the way. So the current situation for me is as head of the division of spine. We have 7 spine surgeons in that realm, and 5 non-operative spine specialists who do injections, things like that. We have a training program with 2 to 3 fellows who are either orthopedic or neurosurgery candidates that want to specialize in spine and do it at a higher level, and we train those folks annually. And we also train the Navy residents in orthopedics to learn spine in the course of their more general training. And as I said, we have a very active research program. It is both basic science and clinical. It's substantially more clinically based, meaning we study how we do things and patient outcomes, things like that, both internally, and then we collaborate with entities around the country and around the world to essentially learn in larger populations how better to do things for our patients. The program that we have is under the purview of Scripps Clinic, and then under another hat, I am a board director for an entity called San Diego Spine Foundation, which is an umbrella organization that helps manage research, educational, and outreach mission endeavors. My partner in that, and one of the faculty for our fellowship training program and at Scripps Clinic, runs this global outreach program through that. And they do care for underserved populations in South America, Kenya, other places around the world that get help both teaching medical providers as well as providing actual surgical and evaluation services in those areas. So a bit of a migratory process going to those other areas, but there's some centers that are repeatedly entered and then served in that way. So that's the short and skinny.
That was not only perfect, but quite the resume. That's awesome. Too cool.
Yeah, it's been fun. The world of spine was someone I chose somewhat from an interest in neuroanatomy. I was a human biology undergrad, but had an interest in neurophysiology, which was sort of an emphasis, and kept that interest through medical training. And spine through orthopedics was a good marriage of good people. Orthopedic surgeons are typically pretty low key, a lot of ex-athletes, fortunately not too ego driven. There's a lot of ego derived elsewhere, and very team oriented, which is a little unusual in medicine, I think, for the most part. But orthopedics really, because of a lot of ex-athletes, I think has a very strong team oriented environment. So that was a nice culture. And then the subject of neuroanatomy and spine and was a good marriage for me. And the other part of orthopedics and spine that was very enticing was that it's sort of an engineering heavy sort of specialty. We have to resolve a lot of problems that are mechanical and engineering sort of based, and so there's a lot of evolution still to come in that arena. And you have to solve those problems on the fly sometimes, and there's a lot of development that we do. So through the course of following training and getting into practice, I also got involved in a lot of product development, started a couple of companies, and now also serve as a general partner in a venture capital firm or fund that oversees capital that gets deployed into various development projects and companies in the medical device world.
Interesting.
Yeah.
I really, that's what I find appealing in my current naive state of medicine.
Mm.
Not in it at all, really, as I have not attended med school yet. But the fascination of orthopedic surgery, as it is so conjoined with like mechanical engineering to some degree, and just trying to make things work, and having the body become sort of a mechanical instrument that you're trying to fix as you would, I don't know, a machine, right?
Yeah. Yeah. It's a very sort of tangible process of seeing a problem, figuring it out, and then fixing it. And people get better generally, which is nice. It gives you, generally speaking, fairly quick gratification that what you're doing is immediately helpful for most of the things that we do, and you're directly involved in that. And then, like I said, the development and sort of problem solving that comes with that is not only by patient, but broadly, you can resolve problems that affect millions of people eventually, depending on the scope of the product or project.
Okay, so I wanna go back to sort of the beginning, for you on like how and when you knew that you wanted to go to med school.
Yeah.
And what that like, did you come in knowing you wanted, or did you sort of change in the middle? What did that look like for you?
Yeah, no, I was actually an early guy. I probably knew as early as 10 or 11 years old that I kind of liked medicine, or that marriage of caring for people and science. And so I came in with a pretty strong notion I wanted to go into medical school. I didn't know exactly what I wanted to do when I got there. In fact, at Stanford, I took a year off after our senior year. I had started that the year before I graduated in cardiology research and worked with a couple of the cardiologists from Stanford on neural networks and AI, basically, that reads the EKGs that get spit out now, and then stayed on with them for that sabbatical year, if you will. And so I thought maybe I'd want to do that, but in the end, once I started doing surgery and seeing a little bit more in medicine on that side, it became evident that I wanted to be a bit more proceduralist, even more so than just the interventional cardiology side of things.
Yeah.
I
And
want to
so what
see
did
no, I'm just
yeah.
kidding.
What did your like preparation for med school look like? Like it's clearly difficult to balance having 20-hour practice weeks, with your coursework, in addition to all of the other things you need to do to prep for med school. So what did you do, and what was the timing of that?
Yeah, it's a different time these days, I know, but I can't imagine that year wasn't somewhat compelling in terms of just research focus and getting some of that under my belt. Doing the academic stuff stands for itself and MCATs, but I think that right now even more than when I went through it. There's a definite um, influence that you can have in a positive direction with showing the interest beyond just those academic pursuits, meaning, go get involved with on a clinical basis with a group of providers or do research. Uh, so many of the decisions now, I think, on the admissions side are getting beyond just the numbers, and they want to see some inspiration one way or the other. It could be outreach stuff, I'm sure, but um, so much of medicine, regardless of what you do, demands an intellectual curiosity. I think that there's going to be a bias towards people that really show that and are doing something in the arena of developing greater understanding, whether it's clinical research or develop product development, something that is a step above just going to class and getting your A's and taking the MCAT and doing well. That's okay, and you can certainly get there that way. But the personal story that you get to tell and the inspiration you give to the interviewers is definitely going to be tipped by those other things. And I can say that even at my level, because I have to interview 30 to 50 people a year for a fellowship candidacy. And it's the same thing. They all have great USMLE scores, and they all come from good institutions, and they have those basics, but then we were actually looking beyond that to people they worked with, getting the inside scoop on how they are to work with and how they are as people, and then how productive they were outside the setting of just going to med school or being in residency, which is obviously very tough. But how many papers they wrote, what kind of papers, what was their involvement in it, what was their level of understanding, the depth of understanding in formulating those research papers or presentations or whatever. So we get into a lot more of that than what was your score, what was your GPA,
Yeah.
what school did you go to.
Yeah. And then with med school specifically, what was was it similar or different than maybe what you were expecting? And did you feel like your Stanford education prepared you for what med school was?
Yeah, definitely. And frankly, even the accommodation, I still think that managing the um, the demands of training all the time and being tired all the time and still going to school um, put at least me in better stead to get through med school and do it pretty gracefully. I was not one of the Stanford stellar students. I spent my fair share of time partying, but training, that back then we had more like 40-hour week training, and then because there were no limits then. And it's daunting because you're tired a fair bit. Jen still laughs at me because I'd be sleeping in the back of OChem after, because we'd practice from 5 to 7:30 or 7 in the morning, and then I would limp to organic chemistry and sleep in the back. Not
Yeah, doesn't
intentionally.
sound good.
I'd be tired and sort of slump over. So those demands actually set you up pretty well. So the energy level of med school was not that big a deal. Residency was different because those are 120-hour weeks and brutal. So that first couple of years of that were a test for anybody, no matter what your background. But it still sets you up well, and the time management skills that you get from having to do that, I think, serve you well when you go into what I'm doing now, which is still very time intensive, but you got to manage family and 5
Yeah.
kids and a wife that is also a professional and other business interests. You have to wear more hats, so the time management is more critical.
Yeah. So talk to me about your residency. And I know that you spoke a little bit already about why you love orthopedic surgery, but but maybe just sort of talk about like the process of getting there and what that was like for you and even residency and how difficult it was with the 120-hour weeks, and what you
Yeah,
were able to do to sort of stay sane. Because I know that
yeah.
that's something that a lot of people worry about with going into medicine.
So getting there is just about application, and there's a match system. So you apply and you get a match. If you're a couple, there's a couples match, which is a different algorithm, and they try to keep you together, but you may not get one of your first choices because you just go down until you're both in the same barrel. Once you get there, it's less daunting than it used to be because there are constraints now on the number of hours that they're allowed to punish you, to make you work each week. Um, so it's a little more reasonable than it used to be. On the other hand, there's a downside to that, and your compression of education um, and cycles of what you're doing, and the volume that you see isn't there. So it probably takes longer now in practice to get to the same point that people used to get in a shorter period of time. It's a little like boot camp. If boot camp is light, guess what? You're going to feel the pain somewhere, somehow.
Yeah.
Or like training, if you're not working hard at the front end and doing it as much as you need to do, or more than the other folks, then you're either going to lose or you're going to have to make it up on the back end and work harder elsewhere. So there's a little bit of that, but once you're there, it's intern years, sort of the time to dive in and just learn all these different things. And there's every time you switch services or go to different hospitals, there's the whole stress of figuring that out on the fly, and trying to integrate all of that while you're taking care of people. And so there's there's more stress in residency provided by the constant change in environment that you have to sort of keep up. It'd be like having a new job every month.
Yeah.
If you switch every month, and you got a totally different group of people you work with, sometimes different systems, computer systems, and you have to adjust to that. So there's a fair bit of stress from that. And then, yeah, even now you're probably working 80 hours a week as an intern, if not more, just to be studying to keep up with that outside the purview of the hospital. And then as you advance in training, you're doing things, you're still constantly learning and being thrown into things that you don't know as well until you're out on your own. And then there's more stress because you're on your own, because you don't have somebody in the operating room looking over your shoulder here and there going, you don't want to do that, or you don't have necessarily the easy access to ask somebody. So there's always new stresses, but over time you learn to accommodate them a little bit better, and you get more comfortable with them. And if you tinker like we do here, you get to continue that process, because you're in advancing the field, you're doing new things or novel things that kind of stress the system or you're not used to, and that's another stress point. You may not sleep very well the night before going out. I'm worried about this one tomorrow because I haven't done this, or it's a brand new technology that we're developing. But that doesn't happen every day like it does when you're an intern. So in
Mhm.
some sense, the frequency goes down on the stress. But overall, it's really exciting, and there's an enormous gratification in medicine caring for people. They are there's not much, I think, and now that I wear hats all over the place, there's not much that competes with what medicine provides in terms of gratification and caring for people. You make somebody's life that much better. And some people save lives, literally, in the ER, maybe a cardiac surgeon who's saving somebody from an imminent heart attack or a current heart attack. Most of the time um, we're saving quality of life, and we're making lives tremendously better
Yeah.
than they were. And that's a pretty strong inspiration. So despite all the stress and pain and misery of getting there, which there can be a ton of, there's no question it's worth it. It's just, you gotta go in knowing there's gold at the end of that rainbow.
Yeah.
Not financially, I mean, just from the fulfillment of caring for people.
Yeah. And you've spoken a lot about how many hats you hold and
Yeah.
like all the different things that you do. Is there anything that you wish that you were like, what is your next hat that you're going to take on? Or is there any hat that you wish that you had done earlier that that you would end up be doing now?
Yeah, I think the two things that um, I always strive to try to manage. One is a hat I've already been wearing, but there's always this constant battle on how well you wear, and that's just balance of life, balance of family life versus professional life. The second hat will be probably more administrative over time, in, in a sense, leadership or health, the health economy, health systems, which just generally are not well managed. They're managed by kind of low level or low tier corporate sort of people, but not with the vision that physicians tend to have for care of people and research and education. And there's some places that have that. It's just not as widespread in the healthcare system in general.
Yeah.
Places like Cleveland Clinic or Mayo Clinic to some degree. There's a few examples of it, but physicians in general are very focused on the care of their patients. They haven't really moved into that sort of managerial position that we probably have to do as a group to make the system healthier. So that'd be the only hat I can see maybe I'd want to do. But right now, I just want to. I'm focused on what I'm doing. Maybe 10 years down the road, I'll do something like that.
Yeah. There we go.
Yeah,
Um, one other thing. So as Ames is growing and we're trying to really help undergraduates know sort of their options and all that they can do.
yeah.
Um, is there anything that you think that you specifically bring to the table as a mentor that you would be able to help with? Like why would someone want to reach out to you? Like what sort of experiences have you had that you think that you can really touch on to help others?
Well, honestly, it could be any of the things that I've touched in my life. It could be somebody who wants to go into medicine or isn't sure they want to go into medicine. Um, what arena of medicine based on their specific skill sets or interests. I could be leaned on for interest in the entrepreneurial side of medicine, and
Yeah.
what good avenues there are for that, and what it looks like on the startup side of things, or on the industry side, on the big company side, and just what all those opportunities look like. I could probably be a bit of a counselor for a lot of different arenas that touch healthcare. Um, even in the world of the lawyers, as I do a fair bit of expert testimony and witness stuff. So if somebody's wants to go into law or feels like they're interested in medical malpractice or personal injury or some sort of legal world, then that's an area I can provide some guidance and experience. And if they're um, just unsure.
Yeah, that's really helpful because I know that so many people, I mean, I've had this experience with myself of knowing that I really love healthcare and I really love caring for people, but is becoming a physician, like all that that entails, is that necessarily the right path,
Yeah,
right? Like, should I go into some healthcare company, right? Or the variety of other things that you that you can do with healthcare. So that's something I hadn't thought of. Thank you for saying that.
sure.
And just to make sure that I don't take up too much of your time, is there any question that you wish I had asked that you wanted to touch on, or something else that you
I don't think
some
so.
parting words?
I talked your ear off, so I don't think there's much more. But if there are things that I sort of touched on too briefly, and then send me an email. We can do this again. So
Yeah.
um, I'm I would also add that one other thing about um, sort of mentorship into the medical field. People are pretty driven for it. The other avenue is just simply access to get experience and mentoring in the research realm. which some med students and undergrads are looking for. In fact, we've had a couple of Stanford students down here this past year doing research with us. So
Oh, that's exciting.
yeah.
Well, anyway, here, let me stop the